Bismillahirrahmanirrahim. Assalamu alaikum. A 38-year-old woman, Gravida 3 para 3, comes to the office for evaluation of abnormal uterine bleeding. The patient had regular monthly menses until 6 months ago when she began to have intermenstrual spotting and has now been amenorrheic for 3 months. She has had increased abdominal bloating and cramping during the last few months, but no hot flashes or weight changes. The patient has no chronic medical condition and underwent a bilateral tubal ligation after her last delivery 2 years ago. She takes no daily medication and does not use tobacco, alcohol, or illicit drug. Blood pressure is 124/70 and pulse is 88. BMI is 29 kg. There is a coarse hair on the upper lip and bitemporal hair thinning. Examination revealed a large pelvic mass extending throughout the left lower quadrant, but no tenderness or ascites. The cervix appears multiparous with no active bleeding. Urine pregnancy test is negative. Which of the following is the most likely diagnosis in this patient? Choriocarcinoma, ovarian thicoma, polycystic ovarian syndrome, Sertoli Leydig cell tumor, stroma ovary teratoma, uterine leiomyoma. So this patient is 38-year-old woman, come to the office having for the evaluation of having abnormal uterine bleeding. She is amenorrheic for 3 months. There is coarse hair on the upper lip and bitemporal hair thinning. On examination, which reveal a large pelvic mass extending throughout the left lower quadrant. So what is the diagnosis of this question? Based on these hints, the diagnosis of this question is Sertoli Leydig cell tumor. Sertoli Leydig cell tumor. And here the correct option is choice D, Sertoli Leydig cell tumor. This patient bitemporal hair thinning and large pelvic mass are likely due to a Sertoli Leydig cell tumor, an ovarian testosterone secreting 6-cord stromal tumor. The Sertoli and Leydig cell are normally found in male testes but can develop in the ovaries and produce testosterone. Malignant proliferation of these cells can produce male range testosterone level can occur and result in rapid onset bitemporal hair thinning and other signs of virilization, for example, voice deepening, increased muscle mass, clitoromegaly. Testosterone level suppresses pituitary FSH and LH release. Patient may also develop signs of anovulation and estrogen deficiency such as abnormal uterine bleeding and amenorrhea, which all these patient is suffering from. Come to the end choriocarcinoma. So choriocarcinoma is a trophoblastic tumor which follow hydatid mole, and choriocarcinoma there is an elevated beta HCG level. Choice B, ovarian thicoma. So ovarian thicomas may secrete estrogen and cause abnormal uterine postmenopausal bleeding that do not cause virilization. Choice C, PCOS. So polycystic ovarian syndrome have slightly progressive symptom towards air and having bilateral slightly enlarged ovaries rather than a large unilateral mass. Choice E, stroma ovarian teratoma. So stroma ovary is a type of teratoma composed of mature thyroid tissue. Patient can have sign of hyperthyroidism, for example, tachycardia and weight loss. Choice F, uterine leiomyoma. So uterine leiomyoma can appear as large pelvic mass with bulk symptom, for example, abdominal bloating. However, patients typically have regular heavy menses rather than amenorrhea. Leiomyoma do not cause virilization. Thank you.